In about 12% of women, the bag of waters breaks before contractions occur, signaling that labor will soon begin. A tear in the bag or amniotic sac causes the water or amniotic fluid to leak out. In most cases, only the water from around the baby's head is released. The remaining water will cushion the baby until birth, and some of it may gradually leak out during labor. For the majority of women, the bag will break later on during labor.
It was about 1:30.
If you're not sure whether your waters have broken, you should still call your caregiver. He or she may want you to come in and be checked. During first stage early labor, the upper part of the uterus contracts. This causes the cervix, the bottom of the uterus, to start to efface, meaning to thin out. The contractions also cause the cervix to start to dilate, meaning to open. In early labor, the cervix dilates to about 3 centimeters. If you're awakened during the night by early labor contractions, it's a good idea to try to go back to sleep.
Well, for early labor, in the beginning, I was trying to continue resting and sleeping, and once I realized that that was not going to work for me, I came downstairs and I started sitting on a birthing ball.
This early phase typically lasts 6 to 12 hours for first-time moms. Since this is usually the longest phase of the first stage, women often feel more comfortable during early labor if they stay at home. It's also important to eat, drink, and rest as much as possible to prepare for the challenges of active labor ahead.
Okay.
Okay, I'm good.
Okay, we keep going?
Yep.
Okay.
If it's hard to rest, it may help to change positions and continue light activity.
You just feel normal right now?
Walking for me was really nice. It was dawn, the sun was just starting to come up, it was still kind of gray, and it was very peaceful and quiet. It just felt like a really calm, kind of natural way to start the whole process.
Partners and support people play a large role in helping moms stay comfortable during the different stages of labor.
During the early labor, I was just overwhelmed with all kind of emotions and everything, and I just really wanted to offer all my support and just be there for her and just encourage her.
In early labor, support people can help mom rest and relax, take a walk with her, and involve her in books, card games, or other light activities.
We went to the nursery and looked at all the newborns, and we were going to be the parents of a child soon, and we were just excited.
A change in the intensity and regularity of contractions signals to the mother that she is progressing to first-stage active labor. First-stage active labor lasts an average of 3 to 5 hours. Remember, this is only an average, and having a shorter or longer active phase is perfectly normal. During active labor, the upper uterus continues to contract. With each contraction, this upper portion grows thicker and stronger. These more intense and frequent contractions cause the cervix to dilate at a faster rate and may cause spots of blood called show. During this active phase, the cervix dilates from 3 to 7 centimeters. When women arrive at the hospital or birthing center, the nurse or primary care provider will likely assess dilation by doing a vaginal exam. If the bag of waters did not break at the onset of labor, it may break any time from active labor through pushing due to the force of contractions.
It's really important to me when I was in active labor and really dealing with those contractions that people were staying quiet, because it was really hard for me to focus when there was noise outside of just my little bubble. But having Aaron's voice in my ear counting and telling me I could do it really helps to bring me back to center.
Support persons can help by providing words of encouragement, assisting her in changing positions often, and using the relaxation and pain management techniques that work best for her. Also, make sure the labor room is quiet and comfortable, and help her rest in between contractions.
I think it wasn't until very late in active labor that I started feeling a little bit unraveled, and definitely not doing anywhere near as much work as Beck was, but just feeling very, very worn out and a little bit helpless too. I think that, you know, as supportive as you can try and be, that ultimately there's nothing you can do to make the contraction pass quicker or anything like that.
The third and final phase of first-stage labor is called transition. Transition is considered the most intense part of labor, but also the shortest, usually lasting between 30 minutes and 2 hours.
During the transition stage, I couldn't get comfortable. The nurse told me to try some moaning. You take a deep breath in and then you go, you just relax.
During transition, the forceful contractions cause the top of the uterus to grow thick and strong enough to push the baby down. Contractions also cause the cervix to dilate completely, from 7 to 10 centimeters. Due to the intensity of transition, it is not uncommon for women to experience hot flashes, chills, shaking, nausea, or vomiting.
Emotionally, I felt completely drained during the transition phase. And I knew that I was heading toward the end, but I didn't feel like I had much left to give. But I knew I had to just keep working through it and keep breathing and keep plugging along.
Partners and helpers can assist mom in focusing during contractions by using direct eye contact and short, to-the-point directions.
Deep breaths, deep breaths.
They can also encourage her to rest in between contractions and give her extra emotional support to keep her from getting discouraged during this intense period. It may help to remind her that each contraction brings her closer to the birth of her baby.
During her transition phase of labor, the pain got more intense for her, so I was massaging her lower back more, and not so much massaging, just a solid pressure. Just stand there and give her moral support, tell her she's doing a great job, tell her, you know, she's gonna get through this, it'll all be over soon.
Transition causes the cervix to dilate fully, and labor then progresses to second stage. Some women experience a resting period of about 20 minutes between transition stage and the second stage contraction. The second stage, when the mother pushes and gives birth, can be as short as 20 minutes or last as long as 2 or 3 hours or more.
I felt a lot of pressure, and I called the nurse and she said, well, do you feel like you need to push? And I said, I don't know. And then with the next contraction, I said, oh, yes, I do. I do have the urge to push. And a lot of people compare it to feeling like you have to have a bowel movement, but it felt like I've just got to push to relieve the pressure.
Pushing was a huge relief for me because it was like, I know that there is going to be an end to this. Plus, it really actually felt good to push, and I could tell that there was progress, so it was emotionally more satisfying for me.
During second stage, partners can help mom change into comfortable, productive positions. Second stage is also an important time for support persons to provide focus and emotional support. Tell her, you're doing great, you're almost there, or just a few more pushes. And remind her to rest between pushes. By this point in labor, the top of the uterus is very thick and pushes on the baby with each contraction, enabling the baby to move through the pelvis. This is called descent. Descent is determined by pelvic station, which is the position of the baby's head in relation to the spines of the pelvis. The baby's position is measured in plus or minus centimeters from these spines. During most of pregnancy, she is in the negative range. After lightening, she is usually even with the spines at the 0 station, and gradually during labor, she drops into the positive range. During second stage, the baby must progress to the +4 or 5 station for birth. As the mother pushes with each contraction, the baby's head descends and then slips back slightly between contractions. To help the head descend more easily, the baby's skull is made up of 5 separate bony plates. These plates mold together to help the head fit through the birth canal, giving many newborn babies a cone-shaped head for a few days after birth.
I use the mirror this time so I can see the progress. I feel, oh, there it is. Come on, push harder.
The top of the baby's head is visible as it emerges and slips back. The baby's head crowns when it stretches the vaginal opening to the fullest. This squeezes the head so it does not slip back anymore in between contractions. During crowning, mothers often feel a burning sensation in the perineum, the skin between the vaginal opening and the anus.
Everybody was telling me that the head could crown, so I reached down and was able to actually feel his head, and it was more like a burning, like a warm burning sensation, more so than it had been before he crowned.
After crowning comes the birth of the head. The baby's head extends and her chin lifts, allowing the crown through and out the birth canal. Her head starts emerging face down and then turns to line up with her shoulders, which are still inside of her mother. With the next push, one shoulder comes out and then the next. After the shoulders are out, the rest of the baby slips out and she is born.
I just feel grateful, and now I have him in my arm and I can see his face. Yeah, I feel that this is mommy and this is my son. I feel that bond.
After birth, the umbilical cord is clamped and then cut. There are no nerve endings in the cord, so the baby doesn't feel anything.
Oh, good job, Katie. Oh, good job.
I was crying a lot. It was a release because I wasn't pregnant anymore, and it was really happy because I finally had my son, and I was finally able to really start this phase of my life that I've been waiting for 9 months.
About 5 to 20 minutes after the baby's birth comes the third stage of labor, the delivery of the placenta. The sudden shrinking of the uterus after birth separates the placenta from the uterine wall. A contraction signals the mother that it is time to push the placenta out. After delivery, the doctor or midwife checks to be sure that the entire placenta has been expelled.
To deliver a placenta, it wasn't so hard. I just felt a little contraction, and then you just push a little bit, and then it's out.
To help the uterus contract and prevent excessive bleeding, the care provider may massage the top of the abdomen, which can be uncomfortable for the mother. The uterus contracts to about the size of a cantaloupe in the hours after birth. The uterus continues to contract and reaches its usual pear size about 6 weeks later. The mother may feel slightly uncomfortable after pains as the uterus contracts. Breastfeeding as soon as possible after the baby's birth helps this process along.
Breastfeeding for the first time was a very spiritual experience. I had a very strong sense of connectedness. You just feel like you're part of the cycle of life, mother and child.
Starting early in labor, massage can be used to reduce discomfort, take your mind off the pain, and help you relax. Long, smooth, rhythmic strokes moving downward often work best. You may want a deep massage that uses more pressure, or you may feel that lighter strokes work best. Effleurage is a specific type of massage that uses circular or side-to-side rhythmic motions on the lower abdomen. Many women find this very soothing. At times, your body may be too sensitive to be touched. In this case, your partner may try massaging your hands or feet.
The massage techniques are very helpful. I think it's a distraction. You're not enjoying necessarily the massage, but it takes your mind off of the discomfort.
Well, the best thing to do is to listen and ask. I can't assume where to touch because it changes from moment to moment. So sometimes I would maybe be rubbing on her lower back and she would say, no, don't do that. Being able to listen to what my wife was going through helped me do what I needed to do.
Hydrotherapy uses water to help you feel more comfortable in labor. Being immersed in warm water relaxes your muscles and relieves stress on your entire body. If your labor room has a jacuzzi, its warm jets can provide a soothing massage. If only a shower is available, the spray of warm water on your belly or back can be quite soothing. The different positions you use during labor have a strong effect on the level of discomfort you'll feel and how your labor will progress. Contrary to what you may have seen on TV or in movies, lying on your back is not the best position you can be in during labor. Your baby cannot easily rotate and descend in this position, and it might not be that comfortable for you.
I gotta sit up. This is terrible.
It was excruciating to lie down on my back. I hated lying on my back. I just felt like there was so much pressure in all the wrong places, and to lie down and not be able to have any type of movement, it was awful.
So you're just gonna face the ball, knees wide, and then try leaning over it.
You'll most likely try a number of positions during labor and then narrow it down to the ones that are working best for you.
Get it to where it's comfortable.
so much more relief off my back.
To be in this position? Yeah, good.
The following positions are all good options: standing, walking, squatting, kneeling, getting on your hands and knees, leaning, sitting, and slow dancing with your partner, which you can do as you follow the rhythm of your favorite music. Or, if you're most comfortable in bed, try lying on your side instead of your back. A birth ball is a large rubber ball that is very helpful in getting you in comfortable, productive labor positions. Sitting on the birth ball can reduce pain by taking pressure off of your perineum. It also allows you to shift your weight around until you're comfortable, relieving back pressure and opening your pelvis more so that your baby can rotate and descend more easily. Rocking or bouncing on the birth ball also provides a calming, rhythmic motion. Check to see if your hospital provides birth balls or if you would be able to bring your own. When it is time to push, the positions you use can help the whole process along, especially ones that use gravity to your advantage. That means laying flat on your back is probably not your best option. You might want to try squatting, semi-sitting, side lying, hands and knees, forward leaning, and sitting on the toilet or birthing stool.
Basically, while I was pushing, I used a variety of positions, and I really found that that was helpful because I felt like I needed different positions at different times. It kind of helped distract me from the pain and helped me to focus on the job that needed to be done.